Hi, I'm Dr. Douglas Stevens, and I'd like to take a moment of your time just to show you what a consultation looks like. This is a process where we take, we take information from you, what you might like to change, the kind of way you live your life, what's important to you, and put it together in a way that achieves your goals, but also minimizes any impact to your lifestyle. It's a very personal process, so rather than having one of our own patients here in order to kind of protect patient confidentiality, I've enlisted my lovely surgical assistant, Denise, to kind of act as the person who's come in for a consultation. So we're going to do this in a rather informal way, and I'm just going to kind of be talking, and this is the way that our consultations are. So I'm going to have Denise turn to the mirror here, and we talked about what bothered her, what she might like to change, and that was that she felt a bit of a tired look. And usually that means that it comes from the eyes and the brows in that area. So we're going to focus on that today, and then we'll kind of expand to some other things that she might think of in the future. So hi Denise,
Hi.
How are you doing?
Good.
When you talked about being tired, I think it's coming from a little bit of descent of the eyebrows. And I was going to show you what an endoscopic browplasty can do for you and how it changes the look of the eyes.
Right.
This is a procedure that's done with tiny little incisions behind the hairline, so you can't really even see these things. And you definitely do not have to change your hairstyle to cover them up. In fact, they're hard to find.
Okay.
And we basically elevate the eyebrow, especially the outer part of the eyebrow, up like that to get a nice arch to it, and it opens the eyes in a different way than just removing the skin of the upper eyelid. And you can almost see that if we did this, we almost don't really need to do anything to the upper eyelids. There might be a tiny bit of extra skin, but it's really kind of fine. And I'll just do it on the other side as well, so you can see, it's a few millimeters, but in facial cosmetic surgery, a few millimeters really makes the difference,
It really makes a big difference.
Now, there is a non-surgical way to get some elevation of the eyebrows, and that's using Botox, what we call a chemical browplasty. We inject a little bit of Botox right in this area here, sometimes just a tiny bit there, to relax those muscles that pull down on the brow, so relatively there's more upwards pull, and the brow, as the Botox kicks in, just comes up just a few millimeters, and it can give a nice shape and elevation to the eyebrows. Botox lasts usually about 4 to 6 months, so this would be maybe 2 or 3 times a year that you'd have to do it to kind of maintain it. But it's a nice non-surgical way to do it, and you can kind of push the endoscopic browplasty off for a little bit if you want to.
And no downtime either.
No downtime with that. And I notice that you have just the very hint of this number 11 look here. Not much, but a little bit of Botox in this area can help smooth that and really relax that area. It's good to stop that motion before your skin gets crinkled into a red line that's there even at rest. So you're at the perfect age to kind of start thinking about some of these things.
Great.
The lower eyelids really look quite good. There's a little extra skin, if you notice, right here. With the lower eyelids, we never ever want any distortion to the lower eyelids. So very carefully we could remove just that little bit of extra skin, with the incision line ending up just beneath the eyelashes there. It hides very nicely. That is something I think that you could put off for a while, but in the future that's probably something that we might want to think about.
All right.
Now, I certainly don't think that you're ready for a full facelift. An active lift is a facelift under local anesthesia that can kind of tighten up the jawline and the neck areas. Yours is still looking quite good, but just for future reference, when we do that, it's a nice upwards, backwards lift right like that. And you can see where the effect is really for that area, right, and along the jawline, I think you're quite early into this, and what we can do rather than that is maybe just use a little filler, either Perlane or Juvederm, right in the corners of the mouth to soften that groove. And we could put a little bit in this area as well to soften that as well. These newer fillers last about 9 to 12 months. They're very soft and natural. I think you'll really like it. And I think that where you are right now, a facelift probably is more than you really need to contemplate. I mean, it'll come, but it's years off right now.
Okay.
And I think your neck, as I look from the side, you still have a very nice angle to the neck. You look good. Most important is taking good care of your skin, especially because we live in Florida, and protect your skin from the sun, most important. The new topical agents that we have here in the office turn over the skin, rejuvenate the skin, change the actual physiology of your skin, and that can help you put off any of these surgical procedures for years to come. When we get to the point where we're doing a surgical procedure, having nice healthy skin makes everything look so much better. So I think for you right now, if we were to do any surgery, we could consider an endoscopic browplasty and a very minimally invasive pinch lower lid surgery. Or we could just avoid surgery altogether and just do some Botox and some fillers and call it a day with that. So I hope you enjoyed seeing a consultation. It gives you a chance to see the way that I deal with patients, and that there are often several different alternatives in achieving someone's goals. The consultations are complimentary, and we'd love to serve you, so give us a call. Our number is 239-481-9292, and you'll find my staff very friendly and helpful. Thank you.